Hey everyone, Sarah Denio here from Kind Nest, and I'm here with Tisha Graham, who is our childbirth and breastfeeding workshop facilitator. Hey Tisha, thanks for being with us today.
Hi, Sarah. Good morning. It's a pleasure to be here.
Thanks so much. So I hear you have some information that might be helpful to our community as it relates to pregnancy, breastfeeding, parenting around these uncertain times.
Okay, great. Thank you so much, Sarah. Yes, hi, everybody. As Sarah said, my name is Tisha, and I am the childbirth educator as well as the breastfeeding educator for Kind Nest. I teach a Saturday workshop every month, once a month on a Saturday. Usually it's the last Saturday of the month. And I also teach a 2-hour breastfeeding class. Usually that's the last Monday of the month. I wanted to talk a little bit about what it is that I do during those classes, and then how it is I might be able to help people, support people, and provide that information to people at a time when social distancing is really something that we are all being very mindful of, particularly during pregnancy. Pregnancy is a natural state of lower immunity to begin with. So I think it's really, really important that as an educator who typically meets in groups of people, typically it is a small group, but still we do meet in groups, that I would like to make my services available in any one of a variety of ways, one-on-one in your home, perhaps a one-on-one class at the Kind Nest location in Boston Lake, and as well meeting your needs perhaps virtually, as I'm doing today. One of the challenges that I think I have with regard to a virtual childbirth class is that a big part of my childbirth class is to not only share didactic information about labor, what's happening in your body, what are some of the things that you can do to support the process of labor, what are some of the things that your partner can do to help support you during the process of labor. I have didactic information, and then I spend a couple of hours in the class, typically doing sort of a hands-on labor support, coping, and labor strategies that are really hands-on. They're in the big, beautiful yoga room. We're on the mats. We're on the ball. We're hands-on. We're sort of doing, double hip squeezes and back massages and promoting ways to promote comfort as well as progress in labor. And so I think that I could probably offer that virtually to a certain degree. But as I said, I'm very, very happy to bring my offerings both in terms of childbirth preparation as well as breastfeeding basics to you in any one of a variety of ways. One-on-one in your home, one-on-one at the Kind Nest facility, and or perhaps virtually. And you can just reach out to me through Kind Nest, and we will set something up that meets your needs during these very uncertain times, particularly during pregnancy. I know that there's a tremendous amount of concern and there's a tremendous amount of anxiety that pregnant people especially are feeling at this time during a very real and significant health crisis, a global pandemic. This has never happened in our lifetime, so we are all treading on uncharted territory, and we are all doing our best to make sure that you not only have information and support to get you through pregnancy, labor, birth, and breastfeeding, but also feel that you have some strategies for reducing some of your anxiety. And I think one of the best ways to really reduce anxiety is to have access to real information about, sort of what pregnant women, what pregnant people really need to know when it comes to the coronavirus and when it comes to COVID-19. I wanted to share with you, just so that you have it in your hip pocket at all times, I wanted to share with you a very, very important website. And Sarah will post that up on the Kind Nest website so that you have access to this link. And then you have access to ongoing, unfolding, science-based, research-based information about pregnancy, labor, birth, and breastfeeding in the age of COVID-19. And that website, that link is evidencebasedbirth.com. Evidencebasedbirth.com. And it is a wonderful website for parents anyway, for prospective parents and for pregnant couples anyway. But particularly at this time, there's ongoing um, research updates available to you so that you can follow what it is that we know now about the research, about the studies, about pregnancy and COVID-19, and whether or not um, babies are at greater risk or breastfeeding is still being encouraged and that sort of thing. So I wanted to share with you just a couple of highlights from that website so that you have some basic information about pregnancy and COVID-19, and then that you go to evidencebasedbirth.com and that you follow their regular updates that will be happening at very least weekly, if not more frequently, as new evidence and new information becomes available. So one of the things that we do know is that there's not a lot of research available yet on the clinical presentation of COVID-19 in pregnancy, in pregnant women and in babies. There have been a few incidences of infants who have contracted COVID-19, and their symptoms have been very, very mild. And as far as we know to date, no infants or babies or children have died of COVID-19 here yet in the United States. And hopefully that remains the case. There is no evidence of mother-to-baby transmission. When researchers tested women who were positive for COVID-19, when women are infected, the samples of their amniotic fluid, the baby's cord blood, vaginal discharge, newborn throat swabs, and breast milk have all tested negative. And so that's very encouraging, I think, for us to know that despite the obvious aggressiveness and damage and destruction that this virus is causing worldwide, that there seems to be a particular I don't want to say there's a particular immunity, but there seems to be a particular low rate of transmission between infected mothers and babies, and there seems to be very, very mild cases among those babies and children who we know have been infected. So again, go to Evidence-Based Birth, and they'll be putting out at very least weekly updates on a regular basis. I will leave you with just some little bits of advice, little tidbits of advice for pregnant women. Obviously, the first thing I would encourage you to do is breathe. Take a nice deep breath, breathe. Put your hands on your belly. Let your baby know that he or she is safe inside your body, safely protected by that amniotic sac, safely protected by your uterus and by your own body. So there is that sense of safety that you should feel for yourself and for your baby during these uncertain times. Obviously, everybody's been telling you, wash your hands, wash your hands, wash your hands. Really good, lathery, soapy, under the nails, back all the way up to the wrists, even up to the elbows. Singing happy birthday, how appropriate. Singing happy birthday at least twice. And really, getting nice, warm, sudsy, soapy, lathery action going on your hands on a very, very regular basis. Keep yourself healthy. And we talk about that in pregnancy anyway. Keep yourself healthy. And the way that we do that is that take good care of our body. Best way to take care of your body, eat well, hydrate. The gold standard for great hydration during pregnancy is half of your body weight in fluid ounces a day. And I know that's a high standard, but many pregnant women can meet it. Half of your body weight, which changes, it increases, as does the pregnancy. Half of your body weight in fluid ounces a day, mostly clear fluid, good clean water, eating lots of fruits and vegetables, particularly fruits, even more vegetables. All of those, in fact, help to boost your immunological system. And getting good sleep. It's very, very important in pregnancy in general, and particularly to keep yourself healthy, to keep your immune system up. Really get some good sleep during pregnancy if and when you can. One of the distressing things about being pregnant, as particularly if you're coming to term, if you're coming towards your due date, is that you probably have social gatherings planned. And you probably have people who want to gather and celebrate and honor you in your pregnancy. Perhaps they want to do a baby shower or a blessing way or a special ceremony for you. This is not the time to do that, and that's really distressing, and it's really disturbing, and it's very disruptive to many families who have really look forward to gathering around the pregnant mom and her family as she gets ready to give birth to the baby. Social distancing, of course, is very, very important. And then the last thing I will say is, have things on hand. Have some ibuprofen on hand. Have some acetaminophen on hand. Have some Benadryl on hand. And of course, have a fair amount of good shelf-stable foods, as well as healthy, live, local, organic fruits and vegetables available to you to keep yourself healthy particularly during these uncertain times. I look forward to hearing from you directly as you make plans to take a class or gather information about pregnancy and birth. I really would be honored if I could help you with that, if I could be your guide. And I will look forward to finding any way that feels best for you to help you meet your need and your goals and your interests with regard to gathering information around pregnancy, around labor, around birth, and around breastfeeding. And I'll look forward to hearing from you. And Sarah, thank you so much for this opportunity to reach out and talk to people directly.
Thank you, Tisha. Wow. You're always such a wealth of tremendous information. So I guess it's really no surprise in this case as well, but really, really helpful information and really comforting to have this knowledge at hand.
Thank you.
I think in your humbleness, you may have overlooked sharing with us your credentials in case anyone doesn't
in case
know
anybody wants to know really what qualifies me for talking about birth at all.
Yeah,
in all honesty,
well known, but just in case there's anyone who doesn't.
Anyone who does not know, my real claim to fame is that I have, in my lifetime, I spent a period of 16 consecutive years where I was either pregnant and or breastfeeding one of the many babies that I have given birth to. I'm the mother of 5 babies who are now young adults in the world. And so that's my real claim to fame, pregnant and or breastfeeding for 16 consecutive years. But from a professional perspective, I am a certified professional midwife. I work in a local home birth practice. I'm a certified childbirth educator, and that's really the skill and the credential that I bring to my work at Kind Nest. I'm also a certified doula, and I attend births on a regular basis, both in the home setting as well as in the hospital setting. And that is really where I continue to learn so much about how the various ways that women work with labor. I learn something new at every single birth that I go to, and I'm probably close to 1,000 births at this point in my career. And finally, I am a certified lactation counselor. And those are the credentials that I bring to Kind Nest. And it is a passion and a privilege for me to continue to share my knowledge and to get to know people in the community. And I look forward to talking with folks further individually, setting up classes, setting up consultations, whatever it is we need to do. We're going to help you get ready for labor, birth, and breastfeeding. And I look forward to talking to you again.
Thank you so much, Tisha.
Thank you so much, Sarah. You take care. Be well.
Your presence is always such a comfort. And it's interesting to see how turns out that translates even over video.
Well, I'm so happy to hear you say that, Sarah. It's my pleasure. It's my privilege to work with you and everyone else at Kind Nest. And I look forward to meeting up with families as we go forward in these uncertain times and really help you get the information and the support and the confidence that you will be bringing to your births so that your birth experiences are as positive as they can possibly be.
Thank you so much.
Okay.
All right.
Take care.
Thanks.
Bye-bye.
Bye-bye.